Hello, my name is Vanessa, and today I'm presenting the topic reducing restraint use in skilled nursing facilities. Okay, so restraint use in skilled nursing facilities can include physical and or pharmaceutical restraints. They're mostly used when a patient shows behaviors that risk their own safety or safety of others. Use of restraints are to prevent harm to the patient or even others. Okay. The types of restraints that can be used are that of chemical restraints, environmental, mechanical, physical, and even seclusion of patients. Patients that are actively with use of restraints should be checked every 15 to 30 minutes for their safety. And also an MD order is required for use of restraints in any setting. Okay, so we're going to go ahead and talk about some of the specific areas that restraints are used, what are restraints, and some prevention that we can use. Okay, so the different types of restraints that can be used for patients include that of lap trays, restraints in wheelchair as a wheelchair safety belts, arm restraints. And with this classification of arm restraints, as OTs, we want to be careful specifically when it comes to our splinting goals and interventions. Make sure that we're documenting the need for the splints, especially if you have a case that requires bilateral hand splints. If the patient is alert and oriented, they're awake, and they have some kind of movement in their hands, we don't want to restrict their use of their hands during feeding, activities, even ADLs. Okay, so when you have these orthotic goals that are 4 to 6 hours use, make sure that you plan not only with the patient, with nursing, what's that schedule going to look like. Make sure it's not during times of eating, feeding, ADLs, and activities that are important to them. In that case, you have a patient with possibly bilateral elbow splints, bilateral resting hand splints, and then they may make a comment that they weren't able to eat at the time because they had their splinting on. And maybe that is important to them as well. They didn't want to take that off, so now they missed the meal. So we don't want to find ourselves in that gray area that patients are not able to do something because they almost feel constricted and don't have that movement or ability. So be careful with that. Make sure you're documenting those schedules. Maybe do one hand at a time. Okay. Other things can be specialty wheelchairs. So also for OTs, we need to be careful with the use of jerry chairs, using them when it's indicated for like a total assist patient that doesn't have the physical capacity to propel in a standard chair. Okay, so make sure when we use those, it's well documented and we're covered on those areas. Also, Broda chairs can follow under that. Broda chairs are great, but they are reclinable and low level as far as like low sitting with a tilt and recline. So we don't want to be impeding someone's ability to perform functional mobility. So if you're using it for a specific reason, but that patient does have physical capacity to use their legs, maybe document some training and also obviously perform it and document that you've trained them in the use of self-propelling with use of their feet so that it's not used as a restraint. They're able to get around in it, but it's what's indicated for whatever reason, okay? And if not, make sure that staff are trained as well as patients and family. Another one is bed rails. Just recently, they've minimized bed rails from the full-size bed rail that encompassed most of the bed, about halfway through past the patient's hip. Now that is illegal for use in skilled nursing facilities. That's where you see that kind of quarter rail up by the head of the patient. It needs to be above their elbow or at elbow length. Okay, so it doesn't restrain them or prohibit them from moving and getting out of bed. Okay, so you see that quarter or 1/3 railing in use now. Also, restrictive clothing. All right, some harm caused by restraints can be an increase observed in falls. Reports of strangulation have occurred. Decreased muscle tone from lack of mobility. Decreased mobility. Incontinence and constipation. And an increase in negative behaviors, irritability, agitation, things like that. Okay, also an increase in infections and pressure ulcers. So a lot of these things are preventable, and in hindsight, using restraints on this population may actually have a reverse effect. Okay, there were studies that out of over 800 patients where restraints were used over 13 different skilled nursing facilities, 8 out of every 100 patients were harmed significantly due to restraint use. When those restraints were eliminated or reduced, only 5 out of every 100 patients were reported with some kind of incident or fall, and the significance was decreased. Like, as far as how bad the injury was, it was more prominent when the restraints were used, and then it maybe resulted in less of a significant injury when they were minimized. Okay, so people may think restraints are actually helping, but when we look at the grand picture, they can tend to do more harm than good. Okay. Now, prevention on the nursing side of the house, they can implement bowel and bladder programs. Okay. And this is timed every hour to 2 hours, depending patient's typical need. All right, if we have a bowel bladder program implemented, this can reduce patients' sense of urgency. Okay, urgency to be impulsive and get up and meet these needs if we're checking on them routinely. Okay, so that's the next one. Checking on the patient routinely every 30 minutes to an hour. Now, if you talk to any nurse, they'll say they're understaffed and they're unable to, but we can definitely train families as well as patients to advocate for their needs in a timely manner. Like, I always teach time voiding. So every 2 hours, don't wait till we get to that 3 hour mark and you have that urgency, you hit the call light and they don't get to you soon enough. Let's kind of premeditate those needs. Let's think, at the 2 hour mark or 2.5 hour mark, we're gonna go ahead and call for the nurse, so that decreases some of that urgency and that impulsive behavior. Okay. Another thing they can do is implement floor mats, so that if there is a fall, there's decreased impact to the patient, reducing fractures. They can, with a doctor's order, if indicated, use concave mattresses. Okay. This will just decrease the risk of the patient rolling over at night and falling off the bed, which happens a lot of times because they're used to maybe a queen and a king mattress and now they're in a twin. So things like that can also help. They can still engage in functional transfers with assistance, but it will definitely minimize the risk of falls. Okay. And then increasing participation of patients in the activities departments and common area for dining and social participation. Get them out of those rooms, get them out of those beds, in their chairs. That'll reduce a lot of their stress, depression, anxiety, and these impulsive behaviors that led to maybe the use of restraints to start with. Okay, and lastly, OTs can provide proper wheelchair assessments, increase balance, strength, activity tolerance, bed mobility to reduce pressure sores, and maybe even pain. If someone's having lumbar pain and they're very uncomfortable, they're very agitated, they're not able to properly weight shift themselves and perform that bed mobility to offload, that will definitely increase some of those behaviors as well. Okay, we want to increase safety awareness and involve family. The more the family is in that patient's life and inserted into their daily routine, that's going to minimize some of that depression, stress, anxiety, the fear of the unknown. If the patient is seeing someone that's familiar to them and they're more involved in their life. So as OTs, we can educate the family and how important that is for them to maybe create a schedule within their family of visiting the patient, maybe even reaching out to the church, having the church send some people over to spend time with that patient. Okay, all of this is going to reduce some of those behaviors and anxieties, depression, and reduce the prevalence of falls and injury without the need of these restraints, because they cause more harm than good. Thanks for listening, guys.